Hi, Alyssa. My name's Sarah. I'm a nurse practitioner. How are you?
Good, how are you?
Good, thank you. So I'm just here today, hopefully, to get to the bottom of some of the things that brought you into your primary care provider. Did they tell you anything about what this is going to entail?
Not really.
Okay, that's fine. So it's going to be a little bit less than an hour. I'm just going to go over some past illness, some present illness, family history, things like that. You had some forms to fill out in the waiting room, so I'll go over those with you.
Okay.
And then we're just going to kind of come up with a plan, so hopefully that we can help you solve some of the issues that you came here with. Sound good?
Yeah.
Okay, so this orange folder is for you, and it's going to have my name, my email address, the address of the building. My hours are 8:30 to 5, Monday through Friday. My email address to contact me if for some reason I'm not answering or it's a weekend and you can't reach me. This is the office phone number. Sometimes if I'm too busy or I can't hear it, this office number will work too.
Okay.
And on the bottom, just so you know, in case of an emergency, just make sure you call 911 or go to your local emergency room. Okay? So we'll keep that in there. You can hold on to this. We'll use this later in the process. Okay?
Sounds good.
All right. So why don't you tell me a little bit about yourself?
So my name is Alyssa.
Mm-hmm.
I am 23 years old, and I'm currently in the new grad program at Mass General.
Okay.
And on this side, I'm also a model, just trying to gain some extra money on this
Yeah.
side.
Okay. Awesome. How long have you been a model for?
About 6 months.
6 months. Okay. Awesome. So what brings you here today?
So recently with the whole modeling thing, my agent told me that I had to lose weight, and that's been something I've been working on for the past 4 months, and this has all been new to me, and I just feel so stressed out, not only with my life, but as well as the whole health part, where I'm trying to lose this weight, but it's just an emotional stress for me.
Okay. So you say you started modeling 6 months ago. When did you first begin having the problems that you are feeling now?
I would say I noticed things were going strangely a month into the whole weight loss.
Okay, so about 4 or 5 months?
Yeah.
Okay. Has there any been problems now or recently at like certain events that have caused the problems to increase or make it worse?
With my work life, I've noticed that I've been more weak and fatigued and tired. And then my relationships with my family and friends, that's become difficult for me. And just trying to stay healthy as possible while trying to do this. It's tough.
Fair. All right. So you said that your family, you're having some difficulties with them as well because of this. Okay.
Yeah.
All right. All right. So I'm just going to go through your past psychiatric history, just some general questions.
Okay.
So have you had any mental health diagnoses in the past?
Not that I know of. No.
Okay. So you've never sought treatment for anything like that? Nothing? No anxiety? No anything?
One time when I was in nursing school, I actually had to take some Ativan to deal with the stress and testing.
Okay.
My boards.
Okay. All right. And who's your current caregiver? And by caregiver, I mean primary care provider.
Dr. Welland.
Okay. And do you see any other specialists? Anything?
No.
Okay. So have you ever been hospitalized for any psychiatric problem?
No.
No? Okay. And you said you took Ativan, correct?
Yes.
How long did you take that for?
Last year for like 6 months.
Okay.
Only for testing.
Okay. So it was as needed. It wasn't on a daily basis.
Yeah, as needed.
Okay. All right. All right. So have you ever had any counseling or therapy for anything? No? Okay. And what about any suicidal thoughts in the past or today?
No.
No. Okay. And any legal history that I should be aware of?
Like
have you ever been to court?
no.
Okay. All right. So now we're going to go over your substance abuse history. Just try to be as honest as you can, and we'll go from there, okay?
Okay.
Any tobacco use now or in the past?
In the past, I would just try it out socially, but now I don't.
Okay. What about caffeine?
I drink caffeine about every day
Okay.
for work.
Alcohol?
Socially, yes.
Okay.
I would say like at least once a week.
So when was your last drink?
Thursday.
Thursday.
Last Thursday.
Okay. Marijuana use?
Only socially. Very rare though.
Okay. And what about cocaine or other stimulants? No. Opiates?
No.
Nope. Benzodiazepines?
No.
Nope. Hallucinogens?
No.
Okay. And have you ever had to go to rehab for any substance abuse? No. Okay. You're doing great. All right. So medical history. You already gave me who your primary care provider was. Yep. And are you on any current meds now?
Birth control.
Okay.
And I take Claritin.
Okay. And do you have any illnesses?
No.
No. Okay. Any surgeries that I should be aware of?
No.
No. Okay. And any drug allergies?
Not that I have, no.
Okay. Awesome. All right. So now we're just going to go over just a general review of symptoms, how you're feeling today, and any problems they might be experiencing. So overall today, how do you feel?
I feel tired,
Okay.
stressed out, and I'm just at a loss of what to do. I just feel like I don't know what I can do with my whole modeling weight loss
Okay.
thing. So,
All right. How about any joint problems or skin problems that you're aware of?
my joints, not really. I just like overall my body just feels weak.
Okay.
When I'm walking around during my shifts at work, I just feel like I can't do the same things I could in
Okay.
a 12-hour shift.
Mhm.
And then my skin, I just feel like it's getting like puffy and dry,
Okay.
not as how it used to be.
Okay. What about any excessive blood loss or any anemia?
I have been noticing that I have been getting my period for the past 3 months.
Okay. Okay. And do you have diabetes or any thyroid problems?
No.
No. Okay.
There's a history of diabetes in my family.
There is. Okay. From who?
My grandmother
Your grandmother.
had type 2 diabetes, but it's resolved
Oh,
now.
okay. Awesome. Any infections? HIV, TB?
No.
Okay.
I was TB positive, but I took medication for that.
Okay. And what about any headaches?
I've had headaches that come throughout the day.
Okay.
Sometimes I feel like they're migraines.
Okay.
I had trouble focusing and clearing my mind.
Okay. Any head injuries?
No.
Okay. Vision or hearing problems?
Sometimes my vision gets fuzzy when I'm at work.
When you're at work. What about when you're at modeling?
Not that I know of. I just feel like I'm in the zone, but definitely at work.
Okay. Do you ever see or hear things that other people don't see or hear?
No.
No? Okay. What about nosebleeds?
No.
No? Okay. And what about, do you smell things that other people don't smell?
Not really. I don't think so.
Okay. Any teeth problems?
No. No.
Nope. Okay. Sore throats?
Sometimes, but I feel like that's more of like a cold or viral.
Seasonal.
Yeah.
Okay. All right. Any heart problems?
No.
Chest pains?
No.
High blood pressure?
No.
No. Shortness of breath?
Nope.
Any coughing? Anything like that?
No.
No. No wheezes? No asthma?
No.
Okay. Any problems with nausea or vomiting?
Sometimes when I'm in this whole process, like I'll get a little nauseous.
Nauseous. Okay. Do you ever make yourself vomit?
No.
No. Okay. Any problems swallowing?
No.
No. Constipation, diarrhea?
Sometimes, like with the diet that I'm on,
Mhm.
I'll have a little bit of diarrhea with all the fads that I've been doing.
Okay.
So,
Okay. Like what kind of diets do you feel? Like you're high protein, high fat, anything like that?
like I'll do high protein, but a lot of those like liquid diets.
Oh, okay.
So,
Okay. Have you noticed a change in your stool?
I mean, they're just a little loose.
Mm-hmm.
I can't, not really.
Not really? Okay. What about any problems with urination? Burning, excessive urges?
No.
Okay. Any problems with sexual functioning or sexual drive?
No.
No? Awesome. Any venereal diseases, HIV, syphilis?
No.
Okay. Do you know when your last pap smear was?
This year, February?
Okay, perfect. And have you ever had a mammogram?
No.
Okay. And so I know you mentioned earlier menstrual cycle problems. So when was the last time you had your period?
Today it's April. I would say January.
January. Okay. And you haven't had it since then?
Yes.
Is there a chance you could be pregnant?
I use birth control,
Okay.
so I don't think I would be, but
Okay.
I would be concerned.
But you haven't taken a pregnancy test or anything like that?
No.
No. Okay. Have you had any seizures?
No.
No. What about passed out?
No, but I just feel like I could be on the verge of passing out
Okay.
when I'm really
Okay.
tired.
Any history of strokes?
No.
Okay. Tingling in arms or legs?
No.
Problems walking, coordination?
At work, I just feel like I'm not as fast, and
Okay. Any problems talking or thinking?
just like the whole headache thing
Okay.
and the stress.
All right. And any changes in your handwriting?
No.
No. All right. You did great. So now we're going to go over your family history, the genome that you brought in when I asked you in the waiting room. So as you mentioned, it looks like your grandmother had type 2 diabetes. You said that was solved.
Yeah, it's
Yep.
resolved. And she just tries to watch her diet and everything. So.
Okay. So and it looks like your father is pretty healthy.
Yeah.
Yep. And so you have an aunt who is obese?
Yes.
Okay, but no other health problems that she is aware of?
No.
And then your mom's family is in the Philippines, so you're unsure of her family history?
My grandpa died of lung cancer.
Lung cancer, okay.
And my grandma's alive and well, I believe.
Okay.
So, no health problems with my grandma.
Okay. And any other family history that you want to mention?
No.
Okay, that's fine. Perfect.
Okay.
All right. So we're just going to go into a little bit about your background, where you grew up, who you are, any family history, anything like that. So just feel free.
Okay. Well, I moved here when I was 4 from the Philippines.
Okay.
And I lived in Middleborough, a small town, but then I recently moved into Dorchester because of my job at Mass General.
Okay.
So.
And where did you go to school?
Fitchburg State.
And I'm assuming you lived there, or did you commute?
I lived there on campus.
Okay. And do you have a boyfriend or girlfriend?
One boyfriend.
One boyfriend. Okay. And how long have you been seeing each other?
A year and more.
A little bit more over a year. Okay.
Yeah.
And what about for social supports? Who do you use for social supports?
My friends, my mom and dad and sister.
And where do you see yourself in about 5 years, would you say?
5 years, I think that I would just be doing my job as a nurse, hopefully progressing my career, and hopefully, starting a family and getting married.
Okay. And do you see modeling in that 5-year future?
Well, for now, I just feel like the modeling is just something I'm trying to do. We're paying my school loans and everything, so I'm hoping that once I get like a promotion, I won't have to do this again.
Okay. But right now, it's
I'm relying on my modeling to get through.
Okay, perfect. So right now, it's in your orange folder. We're just going to go over some of the forms that you filled out. We're just going to go over your results. Okay, so they're right in there, right in that folder.
Okay.
So the first one is the Huda scale. It just goes over your understanding and communicating in the past 30 days, getting around, self-care, getting along with people.
Okay.
So I'm just going to go over some of the questions that I have on some of the scores that you had.
Okay.
So in getting around, I noticed that standing up and sitting down was the only score that you had there as a 2.
Yeah.
What difficulty do you have standing up and sitting down?
I find that I get a little dizzy, like a little hypotensive, I think, maybe.
Okay.
When I sit up or stand up too quickly.
Okay, too quickly. Okay.
Yeah.
All right. And then for self-care, eating, you scored a 3, and all the other ones you scored a 0. So you're having some difficulty with eating?
Yeah, just like trying to follow the whole diet and trying to achieve like the goal weight.
Okay.
I want to lose like a few more pounds for this job that I'm gonna get, so it's just hard.
Yeah. Okay. And getting along with people, you scored a 2 in getting along with people who are close to you. So I know you mentioned a little bit earlier that there's a little bit of strain with those relationships. Do you want to talk a little bit more about that?
Yeah, so when I told my family and my friends, they were a little bit angry about my decision to do this job and for the weight loss. So I just feel like they're a little judgmental and they don't understand what it's like to have this type of weight on me and to rely on this as my source of income as well. So it's just a strain in my relationships.
Okay, all right. And then participation in society seemed to be the big center where you scored a lot of your points.
Yeah.
So let's talk about D6-3. How much of a problem is the living with dignity because of the attitudes and actions of others? You scored that one pretty high with a 3. Do you feel like other people are affecting how you're feeling today?
Yeah, I think it's a lot on me as a person. Like, I'm trying to just focus and do my job, but then I can't get the support that I need because everyone just like feels like I'm not doing the right thing and it's not healthy for me. And I know that, but they don't know what it's like. They're just really judgmental about what I'm going through, and it's just a lot of pressure for me.
Okay, and that kind of answers how much problem did your family have because of your health problems, which was 4, which is the highest one you scored on the whole sheet.
Yeah.
So that kind of makes sense on why you would score that pretty high. And then you said, how much have you been emotionally affected by your health condition? You scored with a 3. So you feel, is it the pressure of your family, or do you feel like it's something else that's causing you to be so emotionally affected by it?
I think it's just overall everything with my family. I just don't feel happy. Like, I'm not happy with myself if I can't get that support, and then struggling to be myself this whole time. It's tough.
Okay. So at the bottom, it just says overall in the past 30 days, how many of these difficulties were present. You scored all. So you feel like this way pretty much every day for the past month. You felt this way.
Yeah.
Okay. And then you mentioned that 4 of the 30 days you were totally unable to carry out your usual activities or work. Does that mean you called out of work, didn't go to some modeling things?
Yeah, I had to call out of work just because I woke up one morning and when I sat out of bed, I just felt dizzy, nauseous, like I couldn't go through working a 12-hour shift with my physical health.
Okay. So then all the other days, 15 to 20, you said you had to cut back or reduce your activities.
Yeah.
Okay. Any activities in particular, like any, exercising or working out that you feel like you had to stop doing because of that feeling?
I couldn't go to dance classes that I like to sign up for or Zumba.
Okay.
I just feel like with the amount I'm taking in, there's not enough to actually burn anything through, so I'm getting more tired easily.
Okay, that makes sense. All right. So do you have any questions about that form at all?
No.
No? Okay. So the next 4 forms that we had to fill out basically all go together just to go over some symptoms. So the first one was level 1, and that just kind of gave me a model of what other forms I should have you fill out. So at the top you can see 1 and 2, you scored a 7, so that was pretty high. So because of that, I had you fill out the next form, which we'll go over in a minute, because you scored pretty high in that category. And then you can see for 6, 7, and 8, you scored a 6, so we also had to fill out that form, just because, again, that was a little bit higher.
Yeah.
And the same with 16 and 17, you scored a 5, so we had to fill out those ones. This is kind of a general tool that we use, and then the other ones are more specific based on the scores.
Okay.
Okay, does that make sense?
Yeah.
Any questions on that form?
No.
No. Okay. So the next one is level 2 depression, so that was based on your score of a 7. So you got a score of 30, which I know might not mean that much to you, but what that basically means is that we go into a 67.4 based on all of the calculations in the math. And that just means you have a moderate depression scale, and that's fine, but this is just going to help us figure out your treatment plan, that you are showing signs and symptoms of depression. Totally fine, totally normal. So we're just going to go into more deep depth about that after we go over that. So do you have any questions about that at all?
No.
No. Okay. And then the next form you filled out was level 2 for anxiety, and that was because you scored a 6. Basically the same exact form, just focused on more of your anxiety symptoms. You scored a 55.1, which means mild. The category for that is less than 55 is no anxiety, and then 55.0 to 59.9 is slight. It's mild. So you were very, very on the cusp of that. But again, something just to look into, as you mentioned, you had a past history with anxiety a little bit.
Yeah.
So we'll touch base with that a little bit in a little bit. But do you have any questions about that form at all?
No.
No. Okay. And then the last one is repetitive thoughts and behaviors. And that was because you scored a 5. So this one is a little bit different. You got a raw score of 8. When you were answering this form particularly, what behavior did you see yourself repeating?
Just like not really eating because I wanted to control my eating habits.
Okay.
It's a lot of like self-discipline and a lot of, it's like just controlling how I eat and everything, so.
Okay. So more of a lack of a behavior, just stopping to do something.
Yeah.
Yeah. Okay. Do you have any questions on any of those forms? These are yours to keep, so you can review them at any time in any other meeting that we have in the future. You're more than welcome to bring them up or bring up any questions.
Okay.
The great things about these tools is that we can use them throughout our progress together and just really take a look at your progress and how your symptoms are managed, and if our treatment plans are working, or if you feel like they're working and things like that. We can discuss it a little bit better. So they're good to have and good to keep on record.
Okay.
Okay. So I think for right now, we're just going to talk a little bit more about what those tests indicated. Like I said, some depression, a little bit of anxiety. So we're just going to talk a little bit about those in more depth, if that's all right with you.
Okay.
Okay. So would you say that you are depressed? Would you say you feel depressed?
I mean, I feel sad and at loss and hopeless at times, but I never would have guessed that I was depressed. So this is kind of new to me.
Okay, that's fine. How has your mood been recently? Sad, that you just said.
Yeah, I would say I've been sad,
Okay.
and it's just not the same of I'm not the same person who I used to be.
Okay. Okay. And what about sleep? Have you been sleeping normally?
No, I've been having trouble sleeping actually.
Okay. What has it been like lately, your sleep pattern?
I can't sleep throughout the whole night.
Okay.
I've been restless, and sometimes like I'll wake up with a headache even after I've slept for the night.
Okay. Okay. So you said you felt really sad. Before you started feeling really sad, what kind of activities did you like to do for fun?
I would like to, go shopping, hang out with my friends, dance,
Okay.
go to Zumba, travel.
Okay. And now that you've had these feelings that maybe could be depressing, do you feel like these activities are less interesting to you?
Yeah, I just feel like it's not, like those are my outlets and I just don't think it's doing enough for me. So I don't know what else I can do.
Okay. All right. And how have you been feeling about yourself in terms of self-esteem?
I don't feel that good because I don't get that support from my family and friends. And this whole weight loss thing, I think it's really affected them. And if I can't get their support, then how am I supposed to feel good about myself?
Right. Do you feel critical of yourself and who you are?
Sometimes I question why I'm doing this, but it's honestly the only way I can pay off everything. So.
Okay. All right. And how has your energy level been over the past couple of weeks?
It's not as high as it used to be. Like I said, at work, I can't eat a lot, so I've been feeling like a lot more weak and tired, and it's just not good for me.
Okay. And what about concentration and decision making? Have you felt like your concentration is increased, decreased?
I think it's decreased.
Okay. What about decision making?
It's been harder for me.
Harder.
Definitely.
Okay. And so you said you noticed a change in your appetite, decreased instead of increased?
Yeah.
Okay. Okay. And do you think food tastes good?
I love food, but it's really hard to just stick to this whole regimen and try to get as much weight off as possible.
Okay. Okay. So now we're going to switch gears a little bit. We're just going to talk about, the assessment showed you might have some symptoms of anxiety, so we're just going to go into that a little bit further, okay?
Okay.
You did great with the depression one, so same thing, simple questions, just answer them as honestly as you can, okay? Do you consider yourself someone who worries?
Definitely. I overthink and I stress out about what's going on.
Okay. What do you worry about?
It depends on what it is, but if there's any problems or conflicts with my family or work, I'll worry about whatever it is.
Okay. And do you feel like you are restless or irritable?
Yeah. If I've had a rough day at work, I'll come home and I'll just have so many thoughts racing through my head.
Okay.
And I just feel like I can't stop them sometimes.
Okay. Yeah, so those who did great. There's 3 simple questions. Now we're going to change over a little bit. Do you know what an eating disorder is?
Not really.
Not really. Okay. So I'm just going to ask you some questions around that. We're going to see how you answer them and see if they match any of your symptoms, okay?
Okay.
Have you ever thought that you were overweight?
I feel like I am now.
Yes. Okay. And you said you dieted. Is this the first time you ever dieted, or have you dieted in the past?
I would say this is my first time.
First time.
I feel like it's a lot more hardcore than what I'm used to.
Okay. I know you mentioned it a little bit with your family, but have you ever weighed much less than people thought you should?
Yes.
Okay. And what was your lowest weight? Do you know?
132.
132. Okay. And do you consider yourself overweight at your lowest weight?
Yes.
Yes. Okay. Would you say that you're afraid to gain weight?
Yes.
Yes. Okay. And I know we already touched base on this. You haven't had your periods in 3 months, correct? But we haven't taken a pregnancy test either, correct?
No.
Okay. All right. So now we're just going to you did great on that too. We're just going to go over, we're going to do a cognitive exam. So this is just a couple of things just to test your memory, just to get a baseline so that for treatment it's much easier if I know how your memory is, your cognitive status, things like that. Okay, so can you just tell me your full name?
Alyssa Janine Benogin Tenorio.
And where are you right now?
I am in Milford.
Okay, and what time is it roughly, would you say?
Around 5,
Okay,
I think.
perfect. And do you know what year it is?
2016.
Awesome. All right, so can you remember these 3 objects for me? Ball, pen, and pillow.
Okay.
Okay? Now, can you count backwards from 100 by 7?
Okay, 100, 93,
Yep.
86. 75. I think I got that wrong.
It's okay. Keep going. One more.
One more.
Yep.
From 75. 62.
Okay. Perfect. And can you spell world backwards for me?
D. L. R. O. W.
Yeah. Good job. All right. Can you tell me those 3 things that I told you to remember?
Pen, ball, and pillow.
Good job. All right. And repeat this sentence for me. No ifs, ands, or buts.
No ifs, ands, or buts.
Okay. All right. I'm going to give you this piece of paper. Can you put it in your right hand and just fold it and put it on the ground for me? Good job. All right. I'm going to write a message. I just need you to read it out loud and then do what it says, okay?
Okay. Close your eyes.
Good job. Thank you. All right. So I'm going to draw a picture, and I just need you to copy the picture, okay?
Okay.
All right. Perfect. Great job. Okay. So let's just go over, we take your folder back. Let's just go over some of the things today. So you mentioned that you have decreased sleep, decreased interest in activities. You have some self-esteem issues a little bit. Decreased energy.
Yeah.
Decreased concentration, decreased appetite, and you said no suicidal thoughts, correct?
No.
1, 2, 3, 4, 5, 6. So that's 6 out of 8 for the symptoms for depressed, and you need to have 4 of them. So I would say that, we can manage this, we can work together for it, but I would definitely say that depression is something that you are dealing with right now. I know it's new, but we'll go over that at the end, and I'll give you some more resources and things when we schedule our next appointment, okay?
Okay.
All right, and then for generalized anxiety, you said that you've been worried for about 6 months since the modeling has begun.
Yes.
You said you had concentration problems,
Yes.
fatigue, you were irritable sleep problems, and sometimes you feel restless. So you scored a 5, and you need 3, which is fine. You've had generalized anxiety before,
Yeah.
and that's something again we can manage very easily. Okay. And then the last one. From your physical, I got what your BMI is. So it's 18.5, and that's actually less than 85% of ideal body weight. Were you aware of that?
No.
No. Okay, and do you know what BMI is?
Yeah, it's a body mass index.
Correct, okay. You also mentioned that you have a fear of gaining weight, that you don't like the way that you look, and that you've missed your period for 3 months in a row, which we could, once we take a pregnancy test, we can make sure that is guaranteed to be related to this, and you just score all 4. So I would say that you're definitely experiencing some anorexia nervosa, which is just the bigger name for an eating disorder.
Yeah.
And I know a lot of this stuff, that's 3 big diagnoses in your first meeting, so I know that sounds a little bit scary.
Yeah.
So we'll just tackle one at a time. So for depression, I definitely want to, continue these meetings and maybe, see another therapist who can be a little bit more specialized in that area. But I would definitely like to see how that goes before we start any medication.
Okay.
Because I would just like to see if maybe we can change some of the habits and hopefully get you back on the right track. I definitely want to get you into a support group, preferably one that surrounds eating disorders. That way you can feel the support that you feel like you're lacking from your friends and family. That way maybe we can help with that mood as well, and anxiety. They kind of go hand in hand a little bit, as well as having eating disorder does. They all go very well hand in hand. And once we kind of, solve one at a time, hopefully the other ones will start to get better as well.
Okay.
The main one here is the eating disorder. From what my opinion is, that they seem to stem off from the fact that this is what's happening. And it's very clear the modeling is very important to you. You have to pay your bills, and you seem to be, passionate about it at the same time. So with that being said, I definitely want you, I'll sign you up to make sure you get some lab work done. One, we just want to definitely make sure you're not pregnant, and that's not where you're getting these feelings from, or where you're seeing weight gain from. I definitely also want to get you some labs, some bone density, check your heart rate, check your blood pressure. You did mention you're feeling very dizzy, and getting up and standing up and stuff. And that's a sign. Eating disorders do, have a big toll, not only on your mental status, but physically, as you clearly could tell from how you're struggling at work a little bit.
Yeah.
So we're just going to get some labs. We'll order those. I'm sure even, if you would like, your hospital can probably do them for you. And that way you don't have to, find another place. We can work with them.
Okay.
But that way we can find out to make sure, if your heart rate is getting too low, things like that, because those are definitely important. But I would also like you to, continue these therapy sessions, and hopefully maybe either find a therapist that specializes in eating disorders. And I would also like you to frequently see your primary care provider. Do you feel you have a strong relationship with her?
Yeah, I would say so.
Okay. I would like to be able to share some of this information with her, if that's okay with you, and have some more routine visits, and hopefully, check on your physical status as well.
Okay.
But other than that, I think that the visit was great for the first start. Like I said, keep all of those questionnaires in there. We'll redo those every few visits just to see how it's going.
Okay.
In there is also your next appointment card, so you can see the secretary on your way out, and she'll give you a date for a new appointment.
Okay.
Again, my hours are Monday through Friday, 8:30 to 4:30. Feel free to call me at any of those numbers whenever. You can email me any questions that you may have, or anything that you wanted to ask me that you forgot to ask me today. And then also, I'm going to be giving you on your way out some new sheets for a newly diagnosed person with these disorders.
Okay.
Because I know it can be very scary and very frightening and overwhelming.
It is. Yeah.
Especially when you don't have the support of your family and friends to talk to them about. I want you to be able to find some supports, and hopefully we can start by just some light reading. And in the meantime, I'll look for some places. Would you prefer them to be in your general area, or would you prefer them to be someplace else?
In my general area would be easier.
Okay, so yeah, we'll look for some support groups. We'll see and how you like those, and then if you don't like those, we'll find some new ones. But that's definitely the start. And I would say going further, again, medication is always a possibility. And there's anxiety medication, as you are aware of, and there's also medication for depression that we can look into if these methods don't work. So don't feel hopeless if the first week goes by and you still feel like there's no change.
Okay. Yeah, I think the support group would be a good first option.
Yeah,
take it
me too,
there.
definitely. But do you have any questions or anything that you wanted to clarify before you go back out and see the secretary?
No, I think this went really well.
Okay.
Thanks for all your help.
You're very welcome. It was lovely meeting you.
Nice to